Good afternoon. My name is Sarah Weiner, Program Manager of Education and Practice at the Association of Schools and Programs of Public Health. Thank you for joining us for today's ASPPH Presents webinar, Trends in the Conferral of Graduate Public Health Degrees, a Triangulated Approach. Today's webinar will be 45 minutes in length. We will begin with a short introduction of our presenters, followed by their presentations, and concluding with time for questions and discussion. This webinar is part of the 2018 ASPPH Presents series. A few housekeeping items of note. While you are in listen-only mode and your lines have been muted, we encourage you to ask questions throughout the presentation by using the question box. The webinar is being recorded and it will be available on the ASPPH website in the archived webinar section soon. All registrants will receive an email with the link to the posted recording and slides when they are available. Additionally, this webinar has been approved for 1 hour of CPH continuing education credit. Our moderator today is Dr. Craig Blakely, Dean of the School of Public Health and Information Sciences at the University of Louisville. Dr. Blakely is also chair of the ASPPH Data Advisory Committee. His work has targeted maternal, high-risk youth, and other disadvantaged populations. He has served on numerous review panels and regularly reviews papers for a number of journals, including the Journal of Primary Prevention and the American Journal of Public Health. Among others, he sits on the Louisville Metro Department of Public Health and Wellness Board, National Board of Public Health Examiners, and Advisory Board for the Nigerian Centers for Disease Control. He obtained his doctorate degree from Michigan State University and a Master of Public Health degree from the University of Texas Health Science Center in Houston. Thank you, Dean Blakely.
Thank you, Sarah, and welcome to all you joining us today for the webinar sponsored by the ASPPH Data Advisory Committee. I'm pleased to have two of my co-authors presenting with me today. Dr. JP Leider is an independent consultant in the public health and health policy space, as well as associate faculty member at Johns Hopkins Bloomberg School of Public Health. He is active in projects and collaborations with foundations, national public health organizations, public health researchers, and academics and public health practitioners. His current projects focus on public health systems, the public health workforce, and public health finance. He holds a doctorate in public health and management from Johns Hopkins. The second co-author is Ms. Christine Flippes. Christine directs the ASPPH Data Center, overseeing the association's data collection, analysis, and dissemination efforts, along with conducting public health institutional research and effectiveness studies. She joined ASPPH in 2001 and previously worked at the Centers for Disease Control and Prevention National Center for Health Statistics. She earned her MS degree in statistics from Texas A&M University, for any of you ags out there, whoop. So we're going to look at, let's see, learning objectives real quickly. Our objective here with this webinar today is for you all to be able to describe trends in the U.S. graduate public health degree conferrals, compare U.S. graduate public health degree conferrals using a variety of demographic and other metrics, and identify employment sectors of recent public health graduates. Our agenda is as follows. Here is an outline of your agenda. Following the introduction to the study, JP will present study methods and results, and then Christine will provide some additional data on employment from ASPPH. We look forward to your questions after that, where we welcome your thoughts and results and your ideas on the public health pipeline to workforce continuum broadly defined. The introduction, I'd like to first acknowledge our two other co-authors, Brian Castrucci, Chief Executive Officer at the Beaumont Foundation, and Emily Burke, who works with Christine at ASPPH, where she's Manager of Data Analytics. The question as to why did we do this study? ASPPH has a wealth of data on public health education, but we recognize that our data is not the total sum of data out there. And while we've seen growth in degree conferrals and schools and programs of public health in our data, we are curious what was occurring beyond our association's data set. Was this growth happening beyond our focus? In addition, education research and workforce research inform one another. By looking at the number of public health degree conferrals in the United States, the results would provide a lens into the public health workforce, both in the US and beyond. As the needs of workforce development grow and change, it's imperative to the accuracy to accurately characterize trends in degree conferrals to estimate the future size and composition of the public health workforce. standardization of public health education. In order to look at public health education across the U.S., we needed to define what is a public health degree. This has been a long-standing challenge, going back to the start of standardization in 1919, 4 years after the original Welsh-Rose report was released. APHA established these the first committees on standardizing public health professional training, and they collected and analyzed data through 1970. As seen in this quote from one of their committee reports, comparable data on public health degrees does not lend itself completely to neat and unequivocal classification. While things are better these days, there are still challenges. ASPPH, which took the helm of collecting public health education data in 1974 with the establishment of our annual data collection protocol, has one valuable resource. For this study, we use that ASPPH data and look beyond it as well. So I'll now turn the presentation over to JP to talk more about the data sources, method, and results. Thank you.
Good afternoon. In our talk today, we're going to go over this triangulated approach that's been mentioned. And what that really means is we created a composite of two primary data sets, one from ASPPH and one from a large federal source, National Center for Education Statistics. So as we think about the first data source, ASPPH data, it's worth mentioning that these data have been collected in various form or fashions for over 40 years. So information on applications, new enrollments, students, conferrals, faculty, expenditures has been collected since 74, with acceptances since 82, salary since 97, and recently graduate outcomes in 2016. These data have been collected from programs since 74, and then we've added programs of public health in 2014. So what we'll be using today really are the graduate data or degree conferral data and pairing that with NCES data. So for decades now, the National Center for Education Statistics has run what they call the Integrated Post-Secondary Education Data System, or IPEDS. And IPEDS collects a lot of information on universities and colleges and institutions of higher education across the US, so including institutional characteristics, costs, enrollment, financial aid, retention, faculty, staffing, institutional financial health, and importantly for our purposes, degree conferrals as well. They collect this information in their classification of instructional programs codes, or CIP codes. So the reason I mentioned this is if we're thinking about a universe of data, NCES really should represent that, because functionally all colleges and universities that want to receive federal financial aid have to report these data every year, and so that's basically everybody. A subset of the NCES data will be accredited schools and programs that are not members of ASPPH, and then a subset of that will be ASPPH. So as we think about how many graduate degree conferrals there are in the US, and we want to try and triangulate that number, one of the first things that we need to do is line up ASPPH program areas with NCES program areas, and so that's what you can see on this table. And what's interesting is that there's a lot of one-to-one, so matching biostats and EPI, for instance, but there are a number of CIP codes from NCES that don't get classified under what they call public health. So you can see that epidemiology, biostatistics, health policy, analysis, those live in different families outside of what the IPEDS folks call public health, and so we need to bring those back in as we're constructing our aggregate estimates. So once we've done this crosswalk, we can move to other types of our data set development. So we pull in data from 92 through 2016, about 25 years. We have pretty detailed information from schools of public health for that time period and programs more recently. We linked the data sets by year, by school, by program area where we could, and degree level. So let's say master's or doctoral. And when we create the composite estimate, what we're really doing is trying to create an estimate of how many public health degrees are being conferred out in the US. And we see some differences between what NCES tells us and what ASPPH members report to us. And so what we did here by school and by year was take the larger of the two to try and create this estimate to get a sense of how many folks are getting public health related degrees. Now, why might these be different? Well, fundamentally, NCES is self-reported in that registrars need to capture and report all of the different kinds of degree programs within the university. The same is true for ASPPH, but the difference here is that in ASPPH schools, for instance, there is this other public health category and that they can report under. And so some of those that are reported as other could be reported to NCES in a different CIP code. So not to get too far into the weeds, but there are a lot of different reasons why the numbers might be larger or smaller from NCES to ASPPH, and we kind of track those down systematically to create our composite estimate. So let's talk results. From 92 through 2016, we saw the number of master's and doctoral degree conferrals increase from about 4,500 in 1992 to near 20,000 in 2016. And overall, that's something like 250,000 graduate public health degrees in the U.S. conferred since 92. As we look at that growth, one of the quick questions that we need to address is accreditation. So if we think about the kind of fluctuation in accredited degrees, we can see that beginning in 92, something like 90% of degree conferrals were from accredited schools and programs. That dipped to about 80% in 2008 and now ranges between 82 and 85% since that time. And that could be because we have new programs entering the marketplace that are taking a while to get conferred, or new programs that choose not to get, to get accredited, or new programs that enter the marketplace that choose not to get accredited. If we look at degree type, from 1996 through 2016, the proportion of master's and doctoral degrees was pretty constant. So 90 to 92% of all conferrals went to master's degree recipients. If you look more closely at what kinds of degrees make that up, the MPH still constitutes the majority of master's degrees, about 72%. Among doctoral degrees, the PhD accounts for about 62%, doctors of public health 15%, and then doctors of science or joint or other kinds of degrees make up the remainder. Pretty consistent as new programs have entered, as existing ones have gone to scale. So that's pretty interesting. And just to give you a sense of how programs are changing over time, this shows some of the major program types within degrees. And you can see that general public health has grown pretty substantially as a proportion of total degrees from 96 through 2016. But what's also pretty interesting is that a lot of the mainstays or core public health program areas like biostats or epi, MCH, and so on, those end up being pretty constant too. So the declines that we're seeing are in the other category, are in environmental sciences, and then some variation in health policy and global health as well. So as we think about how we got from there to here, from 4,500 degrees conferred to now probably over 20,000, there are two primary ways that could occur. You have new programs entering the marketplace, new institutions, schools, programs, what have you, and then you have existing ones that are growing or going to scale. And so if we look at the total number of institutions that have at least one graduate degree conferral in public health, that's about quadrupled in the last 25 years. So now we're over 300. But what's also worth mentioning is that there are many, many institutions that confer a relatively small number of graduate degrees. And so what that leads us to is a pretty small proportion of institutions awarding the vast majority of degrees. So here we show you 65% of degrees being awarded by just 70% of all institutions, which is pretty interesting. Let's talk demographics. So when we started tracking demographics back in the 70s and among ASPPH members, we switched from the majority of degrees being conferred to men versus to women pretty quickly in that data collection process. And so by the early 90s, when we're talking about this time frame for our study, women already constituted the majority of graduate degree recipients. That did increase in the 25 years that followed, from 63% to about 73% of degrees. But what's really changed in that time period is the percentage of students who are of color. So in 92, about 25% of graduate degrees went to students of color. And now we're at about 50%, probably to exceed that pretty quickly. And if you look at which demographic groups we're talking about, as you would expect, the percentage going to white students has declined, of course, but substantial growth since the 70s to Asian and Pacific Islander student populations, Black and African American student populations, and Hispanic and Latino as well. So our analysis really raises a lot of interesting questions, some of which have to do with the study itself and questions that we can answer. So how trustworthy are these data sources? Well, as I mentioned, the NCES data represent basically the universe of degree conferrals in the United States because of how our laws are set up and because of the incentives for schools to report these data. But there are also questions about how those data are reported. So as I mentioned, registrars have to correctly classify and report all of the degrees for their institution, not just public health degrees, right, but everything that they do. And so there's always a question of, is something getting categorized by a registrar in this school in a certain way and in another school a different way? So that's one of the really nice things about being able to look at the ASPPH data to see how well things line up or don't, and to figure out why those differences might exist. From our analyses, these data are pretty trustworthy in our view, and especially once you start to look at the composite estimates, we can create conservative estimates of graduate degree conferrals, and we can kind of expand it to the composite, where we're thinking how many students have a public health related degree from schools and programs of public health from all of the other members or non-members in the US. And so I think that's how we kind of got to where we are. But once we get those numbers, there are other questions that we now are really interested in. Why are students studying public health? How long will these trends continue? So public health has been one of the fastest growing graduate degrees in the past 15 years. And as folks on this call likely know, bachelor's degree level especially. But how long can that continue in the face of really substantial national demographic shifts? This is an open question. And then, of course, are there jobs for all of these graduates? 250,000 since 92. We know that some are going into governmental public health, but the rest must be going somewhere else. So with that, I'm going to turn it over to Christine, and let's hear about that.
Thank you, JP. Yes, talking about graduate outcomes and employment specifically has been a continuous process for ASPPH in terms of collecting this data. We've done it for decades in various fits and starts, and the results that I'm going to show you today are from the ASPPH annual data collection from our last 2 years of collecting this information. So here is our response rate, basically. We collect data in line with the Council on Education for Public Health, which allows graduates up to 12 months to find a employment position, continuing education, fellowship, or other, some sort of outcome. So our data collection over the last 2 years actually covers the graduates from academic years 2014-15 and 2015-16. And they're all lumped in here together in my presentation today. So over that time frame, we had over 26,000 graduates at the master's and doctoral level. We had outcomes, these graduate outcomes reported for 64%, or about 17,000. Of that, we had about 12,000 who said they were employed, and the rest you can see at the bottom side of the presentation here. Most of them, other ones, either continuing their education, find a fellowship or residency type position, There were 3% who were seeking a position at that time, and there is a significant unknown in terms of the 10%. What we're going to talk about, what I'm going to present today, is the 71% who are employed and what employment sector they went to. So trying to answer that question, are there jobs for these graduates? So here, this slide is showing you employment sectors by degree level. The orange is in the master's, and the kind of aqua color is the doctoral degrees. And you can see some differences by master's versus doctorate. For the master's, the healthcare organization is the top one at almost a quarter of them, moving on into employment in the healthcare industry, followed by academic, government agency, and for-profit, which are pretty much in line. And lastly, the nonprofit. And of course, for the doctoral degrees, quite a difference. Most of them are going into academia, followed by government, healthcare organization, and for-profit. Now, one thing to note, we're going to dive into a couple of these into a little bit more detail, but I will say healthcare organization, most of those students say graduates are going into the hospital setting. And the academia, it's into post-secondary. And for the nonprofit, it's usually an NGO or some type of association, like foundation like that. But looking at one that comes up when you talk about public health workforce and working in the government is one of those areas that has a lot of people looking at it. Here, the slide is showing the kind of the detail. What is the setting where these employed folks are working? Once again, the orange is the masters, and here, much smaller number. We only have 1,500 reports here. And the doctoral is in the aqua color, and that is reported for 173. So this is broken out in two different ways. So we have federal government general versus federal health and human services. Likewise for state government or the health department, and the local government versus the local health department. I just wanted to ask that in our questionnaire so that we could see if there were differences between the two. So quite a difference in terms of doctoral level. Most of them seem to be going into the federal setting versus the state or local. And then for the master's degree, you can see more into kind of the state health department or the local health department. And looking in for-profits, this seems to be a growing section, and it definitely is at the bachelor's level. That for-profit is the place where the most of the bachelor's degree graduates seem to be landing when they're getting their employment position right after earning their degree. But here we have master's and doctoral. Once again, master's in orange and not doctoral in the kind of aqua color. You can see, not surprised, so you have consulting is the top one for the master's degree, followed by the farm. And then the health IT is one that seems to be growing for this group. For the doctoral, they're ending up more in the pharmaceutical, biotech, or medical industry, followed by consulting as well. So this area, like I said, just seems to be a growing area for profits in terms of our graduates finding degrees. So the education, the research that JP mentioned earlier today is definitely a lens into the workforce, and then finding out that middle piece, where do our graduates land right after they earn their degrees, but what happens later on after that is yet to be determined. But it is an exciting time in public health with all of these students definitely wanting to study, not only at the graduate, but also at the undergraduate level. And it's definitely a dynamic and diverse field, as our president says. And we can see that changing if you compare these graduate outcomes and these employment results to employment results from decades ago. The field has definitely changed a lot. So now we will hear. Oh, thanks, Sarah. There you go.
Go ahead, Christine. Sorry. Thank you, Christine, Craig, and JP. As a reminder, you can submit your questions using the question box. Just type them right in there, and we'll address them now. Oh, did you want to note this, Christine, before we go to questions?
yeah, as people, if they have any questions or comments, we welcome, what you think about these results, and how you think they might be useful or not useful. We welcome all your comments. We do have a couple of resources in terms of the article that was published, and you can find those here on the ASPPH.org Connect/Data Center. There's an article, the infographic, and we also have this interactive dashboard. So you can come on here and select the degree or the program area and watch the data change. So it's just a way to interact with some of the data.
Great, thank you, Christine. The first question asks, how many degrees were classified as other, and can you give a few examples of these types of degrees? I think she's talking, this person is mentioning this one.
Sure.
Yeah,
go ahead.
Yeah, I was just saying there's a category for public health other, and in that first slide, that NCES and ASPPH alignment, there is a public health other category for both of ours. But what's included in there?
So it's changed a little bit in the last few years. And I think it's probably most applicable for the ASPPH data, because you could have theoretically any program that's delivered within a school, or a degree type within a school or program of public health. So for instance, in my alma mater, we had kind of traditional public health programs, but there was also biomedical, nutrition, and food science. There was also some kinesiology. And so you've seen members report in that other category some of these. And for each of those that I just mentioned, there is a CIP code that corresponds specifically to kinesiology or specifically to nutrition. And so that's why you might see a bit of a disconnect. The allied health more broadly, being those degree programs being delivered in schools and programs of public health, I think has also somewhat inflated the public health other numbers. And I think recently, Christine, you guys have a bit changed a bit how you capture that, right?
Right, exactly. So public health general was added a few years ago, and since then, since we developed this paper, we do have allied health and a few other ones. I think we've been responding to what our members have been doing internally in some of their changes, and with the new Council on Education for Public Health criteria changes, we're not even sure where this is going to go yet in the future in terms of how we decide what program areas we're going to be collecting. A lot of changes going on right now.
Great. This next question, one important issue related to MPH curricula would be the number of baccalaureate grads entering grad programs prior to employment. Is there any information assessing this?
We have some information on that with the SOFAS data. So when people are online application for master's and doctoral degrees, and we can see their majors as they're applying. And while there has been growth seen, it does go a little bit to that trouble of defining what a public health degree is if it doesn't say bachelor's in public health specifically. I think the first time we looked at it, we were surprised how low it was. We thought there would be more transition. But like I said, sometimes with the data, with how the degrees are named, that it hasn't been completely clear. JP, Craig, anything to add on there?
I think that's the real issue there.
Yeah, when we looked at the bachelor's question a few years ago, we tried to look for where folks might be able to go or might be inclined to go after getting a bachelor's in public health of some kind. And this was when we were still seeing a really substantial upswing in bachelor's of public health, but I don't think that the field had quite been hit by just how many there were. And so we looked, how many are going on to graduate degrees in public health, like Christine said. We tried to look for medical school. And the reality that we saw then, I think, is being borne out by by graduate outcomes data being collected now, which is that many people just do go back into the workforce or aren't going into a higher, or rather into graduate education in public health per se. They might be pursuing other kinds of health or medical degrees.
I would add two other comments, I guess. We see a lot of people who come into public health who are interested in the clinical professions, medical school, dental school, and so you see an increase in the number of pre-med sorts of public health degree programs these days. The other thing is that I think it's a little premature to get to the numbers on this, but I think we're going to see a lot of 4+1 kinds of transitions where schools are actually building in, the 5-year joint degree plan. And so I think those numbers are going to go up because of the efficiencies of that opportunity.
I think that's right.
Great. The next question, this person saw MHA listed on the graph. Was that referring to just MHA degrees that had a public health specialization specifically?
Well, generally, I think that just refers to MHA or MSHA degrees that are housed in public health schools as opposed to in business schools. And the real plus from my very biased perspective on that is you do get that exposure to population health in the MHA program that you typically wouldn't get in a B school environment or some private MHA training program.
Yeah, and what I'd add to that is within the NCS system, there are different classifications for MHAs based on where that program is housed, like you likely said. So in our case, it is the public health ones.
Great, thank you. This person asked, do we know where these students are coming from? Has there been any corresponding research done for a decline in other degrees or fields?
That is a good question.
So, yeah, no, it's a great question. And one of the nice things about having the access to the NCES data is that you can look at what broad fields as well as specific types of degrees have been, on the wax or wane. So as mentioned, public health really has been growing substantially at the graduate degree level for about 20 years, especially the last 15. And so at the same time, if the question is, where are we seeing some of those trade-offs coming from? You see business on the increase still, but you see teaching, which used to be one of the largest areas, on a really incredibly substantial and sad decrease. So just in that loss alone has been pretty substantial. But the number of graduate degrees in total has also been increasing. So it's both a question of proportions and totals.
Interesting. And we have one more question, it looks like. So if anyone else has any questions, please submit them now. Are you also using this information to make predictions for future trends?
Yes, we are, definitely. ASPPH is looking at that using both of these data sets, our ASPPH annual data and our NCES data, and trying to inform our members in the field what might be coming.
That's obviously a critical issue. And for example, one of the things that we know in Kentucky now is that the number of high school graduates across the state is going down between 100 and 200 a year. And so there's a maintenance issue there that's really critical in terms of general resources to the university through state coffers. At the same time, we've seen other disciplines go through a real decline in enrollment numbers. Law is a great easy example, and so clearly part of what we're trying to do here is build the base from which we can start looking at those sorts of data so that we can get as early a heads up on changes in trends so that we can plan accordingly. And those are really important issues to a whole bunch of the schools and programs that are out there. And so that's part of what this is about.
Wonderful. Oh, just an observation. Someone has submitted one minor point for future consideration might be inclusion of not-for-profit and government jobs in IT, as well as in for-profit settings to better assess the growth you noted in this area. And that is all the questions that are currently have been submitted. Do you all have some closing comments before we close it out?
Well, let me say thanks first to JP and Christine and Brian and Emily for all of the work that went into pulling this together. We're certainly pleased to provide this research to both academic public health and the field of public health. It's been an exciting time of change for public health with the growth in the last couple of decades and the changes occurring in the education of our students. The Council on Public Health has new criteria, or Council on Education and Public Health new criteria, and ASPPH has launched the Framing the Future project, the second 100 years of education for public health. Both were really designed to ensure that public health students gain the competencies necessary for 21st century workforce. Continued monitoring characterization of the public health degree conferrals at the undergraduate and graduate levels will continue to identify trends to inform the field and workforce. At the same time, research on the public health workforce will also inform education, and we must continue to seek ways to understand career paths of graduates, to monitor and characterize the public health workforce as a whole. The National Board of Public Health Examiners has got a workforce study that's being revisited again as well. So there are a number of different ways to look at these things, but this has been, I think, one reasonable step to inform this whole discussion, and we look forward to conversations as we move forward, because this is really important, obviously, to our future.
Wonderful. Thank you to all of our presenters and our moderator. As a reminder, this webinar has been recorded, and all registrants will receive an email once the recording and the handout of the slides are posted. And just a reminder as well that our undergraduate summit and our annual meeting are coming up in a few months, and registration will be opening soon. Thank you all. Have a good day.
Bye.
Bye.